Hello, everyone. Hopefully you can all see me. Um, we're very delighted to have the next in the series of our Building COVID Research Collaboration webinars that are being hosted by me, Alexia Kelly, who is the Senior Director of Research at the Gilling School of Global Public Health, and also Penny Gordon-Larson, Professor of Nutrition, and our Associate Dean for Research, who's having a small problem getting logged into Zoom, but hopefully we'll resolve that shortly. We also have more of these COVID webinars coming up in the coming weeks, including Drs. Whitney Robinson and Anjali Palmquist, who will be speaking about COVID and kids next week. So please stay tuned for more information about that. For the logistics, I'll be introducing the speakers and they will each speak in turn, and then we will follow both the presentations with a Q&A session from the viewers. We ask that you type in any questions you have for the presenters into the Q&A box. You can do this throughout the presentation, and then following the presentation, I'll moderate the Q&A session and read out the questions aloud. The title of the talk today is Social Distancing Privilege in Real-Time Message Testing in North Carolina. I will introduce both speakers now before their presentations. This is a challenging time for all of us, so we've asked each of our presenters how they are coping. Our first presenter is Dr. Nabdis Gupta, who is an alumnus of Gilling School of Global Public Health and a senior scientist at the Injury Prevention Research Center. His COVID coping mechanism has been to raise his chocolate consumption to Willy Wonka levels. Dr. Allison Lazard is an assistant professor at the Hussman School of Journalism and Media. Her cat Fiona, which you might be able to see in the background, has been her steady co-pilot through the pandemic. Fiona has her own seat at Allison's desk, and she promptly walks over and gets in it when it is time to start the day, and they stay at the desk together until dinner time. All right, thank you both so much for presenting, and I will let you take it away.
Great, good afternoon. Thanks for having us. And I'll be presenting on the data aspect of what we have done so far, and Allison will be presenting on the message testing. And so just in terms of disclosures, this research has not been funded, and we don't have any financial relationships with the data vendors who are going to be talked about here. So, let's see. Okay, so the first part of the talk is going to be on understanding what privilege means with social distancing in North Carolina and throughout the United States, in what we've been understanding of our new situation over the last few months. It's not really surprising that social distancing has a privilege concept with it. Anybody who's lived through this can understand and feel compassion for the people around us. The concept of privilege has been, in relation to social distancing, has been discussed online from India to the Philippines, Lebanon, Indiana, everywhere in between. And it's the kind of pop culture understanding of privilege is really like a one-word concept. In health behavior and in public health, we try to think of it as systems of privilege. So how different forces come together to result in that kind of, in the circumstances that let certain people do things better than others. And Allison will be telling us a lot more about the behaviors and how we understand those in relation to privilege. And I'll be kind of explaining what we see from a farther away view. So the driving our hypothesis when we were starting this research was to understand whether social distancing shows what we call the healthy user effect. The healthy user effect is something that we've observed for a long time in health services research. And basically it means people who partake in one preventative measure are more likely to take part in other preventative measures or just be healthier in general because of their choices. So going back to behavior as an important part of what we're looking at. So we hypothesized that social distancing has a strong voluntary component as well because of this healthy user effect. So our goal was to quantify the specific dimensions of the privilege system that may have helped people social distance with more intensity than others who didn't have those same types of privilege. So the goal was to find those as a way to understand motivations and to inform the messaging that would be helpful in encouraging people to remain social distance. So to give you a flavor of what's ahead, we look at a lot of smartphone mobility data, and I'll describe that in glorious detail in just a minute, but here's just a small kind of example of what we can do. So these data are looking at using cell phone location data to understand who's staying at home over the last 5 or so months. So these data that you're seeing on this slide go through Tuesday of this week, May 18th. And what the first kind of research question we had was to understand what impact the stay-at-home orders may have had on North Carolina residents. So the stay-at-home order from the governor came through on March 30th, I believe. So where you can see the red dots on the right is after the standing order, the stay-at-home order was put into place. What you see actually on the vertical axis in the blue field is that there was an increase in people voluntarily staying at home before the stay-at-home order. So in mid-March, as fear of COVID became widespread, schools closed, businesses shuttered, and offices shifted to work from home. So collectively, these changes led people to voluntarily limit their movement in the weeks before the formal stay-at-home order. And you can see actually that in the red dots and the slight downward slope there, that the amount of people staying home all the time in North Carolina has decreased slowly since the stay-at-home order. So it was really, I think, the school closings that led people to restrict their movement when it comes to social distancing. A couple other interesting things, the day with the least movement, so the most people staying at home in North Carolina is on Sundays, and it's true across the country. And on Easter Sunday, we noticed people staying at home more so than even usual, maybe watching church services online or cooking those elaborate meals. So in order to quantify the systems of privilege that may operate, we looked at 11 specific metrics. And the link that I showed at the beginning, tiny.cc/COVIDNC, has all the details on how these definitions were constructed. But these are they're organized into 4 domains: healthcare, economics, and structural and demographic. For the ease of this presentation, I'm combining the economic and structural. But these are all questions that have come up during the public debate on social distancing that relate to how the different orders and demands of social distancing may impact people, different communities in different ways. So for example, school lunch eligibility is a program for low-income children to get free lunch at schools. One of the arguments against closing schools was that this important source of nutrition would be not available to those students who need them. So each one of these dimensions has a kind of basis in the conversations we were having at that time. The data source we use for this is the Robert Wood Johnson Foundation's County Health Rankings, and you can see the details listed on the bottom corner of your screen there. So there's a lot of COVID mobility dashboards that use cell phone data and movement tracking that have proliferated throughout the digital world in the last few months. And these are data that had originally been used for marketing purposes and other things, but were just kind of being applied to public health. And like many of you on this call, I suspect there's a great bit of skepticism on what these data can actually tell us. And so what we were trying to do is to understand what these data are useful for in public health and what transformations are needed in order to separate signal from noise and make actual inferences on health. So these are some of the data sources we collect and pull in, but the data source not shown here, one of them that we used for this analysis from Descartes Labs, I'll be talking about in more detail in just a minute. So a little bit on how cell phones collect this information is probably helpful. So what happens in addition to getting directions and maps, many other apps also use your location to improve the user experience. So these include apps for weather, restaurant reservations, banking, airline check-ins, even your camera logs your location if these settings are open to it. Social media accounts and ride sharing obviously uses your GPS. signal. So anytime you see that blue dot with the bigger blue circle around it, that GPS signal is being used. So the location information is used to micro-target advertisements, but the aggregate data are also anonymized and bundled to be used for marketing insights and can also be used for public health. So there are 5 types of GPS data that are generated by mobile devices. So the first is from apps and APIs, and this is something where your weather app knows where you are, and this is pulling in that information. There are other types that we are not going to get into very much, but one example with wearables, Fitbit has an option where you can sign up to do COVID symptom tracking in addition to the data on your movement from your wrist wearable. So there's a lot of different ways in which these device data are generated. An overview of the methods of our study. So first, there is a data processing step where we started off with basically dots in space and an ID of the device for each of these dots and a date. So those device locations were filtered, and I'll explain that in just a minute. And what we did was we compared the change in mobility and the change in movement from a pre-COVID baseline to mid-April. So we're really looking at mid-February to mid-April in terms of the contrast here. After that, after pre-processing the data, we can move it on to our primary analysis where we brought in those social, privilege metrics, and we created statistical models to understand those better. Finally, we did an external validation where we used venue-specific traffic information to see how much our results correlated with venue-specific changes in movement and attendance. So to give you an idea of what our measurement was, if you look at this little graphic here, if this is someone's home, the path that they take running errands and doing whatever they need to during the day is in this dotted line. And the way we calculated the measurement here was to look at the distance between the home and the farthest point traveled in that given day. And in order to get the purest signal of information, there were a lot of steps that the data provider, Descartes Labs in Santa Fe, New Mexico, what they did to process the data. So for example, the minimum observation time was 8 hours on a given day. So we're not looking at distances from transient use of these apps. There's also minimum accuracy and other filters to help make sure that we're getting the most accurate information. One important thing is that we were requiring a minimum of 10 reports per day to be in the data set for a given county in order to protect privacy of people. So the dates we were looking at specifically for this study were April 15th, 16th, and 17th, and we averaged the median distance traveled by county for those days. The baseline period was mid-February, as I mentioned before. This allowed us to analyze 2,633 of the US counties, and the number of device mobile traces that we had to analyze was about 65.5 million. There were 2 big confounders that we understood we really should be adjusting for. So confounders are specifically rurality and stay-at-home orders. So we can imagine that if you live in a county where your alcohol consumption may have gone up during this period and your ordering from online services has filled up your recycling bin, the nature of the social distancing experience is different in rural areas where you're going to have to drive further to get to grocery stores than urban environments where you might be able to walk to them. So in order to control for that, we used a federal standard, RUC codes, and these basically allowed us to compare social distancing within levels of rurality. So we were comparing places with the same level of rurality in terms of their social distancing and the privilege metrics. The second thing we wanted to make sure we accounted for is whether a stay-at-home order had been implemented in that place. And by the time we were doing the analysis, about 87% of the country had been under stay-at-home orders, and we had, yeah, so that's about it. So one important thing is that, we think when we look at the next set of, when we start looking at the data here in just a minute, we'll wonder, are we seeing a rurality effect? And what was a little bit surprising that, there's kind of this narrative that the places that slowed down the most are urban areas because of the conveniences in urban areas. But we found that wasn't exactly true. So in the highest tier of social distancing or movement restriction, so let's call that social distancing for now, the 33% of the places in the highest level of social distancing were towns of less than 20,000 people. And at the same time, in the lowest tier of social distancing, where the movement continued the most, about a quarter of those were in large metropolitan areas. So the narrative that there is a pure urban-rural divide is not empirically held up. So we had to do some other calculations to kind of really understand what the inferences are. So what we did was we took all the social distancing counties, about 2,633 of them, and we divided them into 5 groups based on just equal quantiles. I'll call them quintiles. And you can see here that the difference in mobility change from baseline was 86% in the places with the most social distancing, down to about 33% in the places with the least social distancing. And you can see the US average of decline in movement was around 60%, which is right here in the middle tier as well. To put this into real world terms, the median distance traveled per day in the greatest social distancing counties was about 1 kilometer, versus in the least social distancing counties, it was about 7 kilometers. So that kind of gives you a sense of what's actually happening here. Okay, so the first result that we found was we wanted to understand whether the stay-at-home orders, kind of what was the level of magnitude of impact of those orders. And we're analyzing a time period in mid-April at which all states that had stay-at-home orders, those orders had been in place for at least a week. Most had been for at least 10 days. So the tapering off had already happened. South Carolina is a little exception. I think it was a few days later than that, but we were able to observe all of that. So this one kind of surprised me, at least. The places with stay-at-home orders, the mobility reduction was about 50. These are switched. I'm sorry. Sorry, these are switched. but the places without stay-at-home orders had a 52% reduction in movement, whereas places with social distancing and stay-at-home orders had a 60% reduction in mobility and social distancing. So what we find is that places with and without without stay-at-home orders had similar levels of voluntary movement restriction, which I think may have been from the school closings, business closings, and other factors. So in terms of when we think of the context of protests against the stay-at-home orders and kind of this perception of a heavy-handed government mandate, I think there's a lot more going on with the picture about how people feel, what they think, what they are doing that supersedes or goes beyond what the top-down government level approaches are. So now I'll show you some of the privilege metrics. And so the way that so first of all, we're using in the next set of slides, we're using changes in mobility from baseline as the proxy for social distancing. I know there are many other ways to social distance. This is the gross general metric we're using to make the inferences for this research question. The way to read the graphs on the next page is to look at the horizontal axis, and it goes from 1 to 5 with more movement on the left and more social distancing on the right. So on the right-hand side of the right-hand side of the axis is more social distancing, less movement. And then on the vertical axis, you'll see the different privilege metrics: income, school lunches, things like that. All right. And all these models, I should say, have accounted for rurality and the stay-at-home orders as well. So this is across the 4 domains: healthcare on top, followed by economic and structural in the middle, and demographic differences on the bottom. And what you see right away is that there's a very clear linear trend for almost all of the things, all of the privilege metrics we looked at. And if we just focus on one of these economic ones to start with, so the annual household income in the 80th percentile was much higher, about 140,000 in places that had the most social distancing versus about 120,000 in places with the least social distancing. It also held true for the median as well. In terms of, so yeah, but what you can see again is a strong linear trend. So the places that had the most social distancing had multiple ways in which they were healthier, wealthier, and better off, and had the structural and built environment needs, which may have helped them social distance more effectively than places without. Okay, so we'll go into this in a little bit more detail to understand what this means. And this time we're going to look at the same data, the same similar models, but to simplify things a bit, we're going to compare just the places with the most social distancing with the places with the least social distancing. And so we're looking at the contrast between those 2 red dots. So we can see it here. So basically places that had more social distancing had fewer uninsured people. They had more primary care providers. So places with more social distancing also had more exercise opportunities in terms of the built environment and physical space. There was less food insecurity. There was less need for lunch subsidies. There was higher income and less residential overcrowding. So all these are things that may, from your own experience, probably lead you to understand that having access to, having a less crowded home may make you feel like, okay, I can hang out and stay home a little bit easier than if you're living cheek to jowl. In terms of the demographics, what was interesting was that even though there's been a lot of discussion about the behaviors of certain age groups, the demographic factors actually seem to be the least of the important factors here in terms of social distancing. The other factors seem to have more of an individual impact. That's not to say that we can't understand what the motivations and look at those demographic groups are, but in terms of like the need for focus, it's really on, there's a lot of individual level things that go beyond demographics that we also need to be understanding, which Allison will definitely enlighten us on in just a few minutes. The last thing is that, here's the confidence intervals for these, for the folks who like to see some extra numbers on slides and understand the precision. But one of these contrasts in particular I wanted to point out, which is between flu vaccination and the number of primary care providers. So this is just taking the data from that last graph and making it simpler here. But I think this serves as a really salient example of how what we can do to close the privilege gap between places that have an easier time social distancing from places that do not. So if you think about the flu vaccine when it was first kind of made available decades ago, it was only available in medical settings. So there's been years of reducing the structural and financial barriers that have made the flu vaccination more accessible. You can get it at the state fair, you can get it at your pharmacy, in addition to all the medical settings as well. It's also financially covered either for free or low cost by most insurance programs. The metric we used here was with Medicare beneficiaries over, so the elderly population with social health insurance in the United States. And for that population, the flu vaccine is free. So basically what could have been a disparity that we see with primary care providers per capita, we might have seen with flu vaccines. This leads us to conclude that if and when we get a coronavirus vaccine, we should really be thinking of all the ways in which the structural and financial barriers for getting the flu shot have been removed over the years in order to be able to get this distributed to a lot of people. So finally, we did a validation study. So we compared the data that we analyzed to measure social distancing with venue-specific information from Google Location Services. So this is one of the data sets that we pull in that I mentioned on an earlier slide. Now, the reason we didn't use the Google data to begin with is because they don't provide any sort of methods that would allow us to have a scientific assessment of what the data mean in detail and and how representative they are. But still, they're one of the largest data sets. And that's why we preferred working with the data set that we did, because the methods transparency in that data set, I think, is higher and of higher quality than any of the other data sets that are currently available for COVID mobility tracking, publicly at least. So what we saw here was pretty much what we were hoping to see, but not sure if we would, which is that we had strong correlations between our social distancing metric and people staying at home. We also saw strong correlation with reductions in retail traffic, offices, and transit. We didn't see a strong correlation with groceries and parks and public spaces. The grocery also includes pharmacies as well in this category here. So what this tells us is that the grocery and parks are the places where people continue to go while kind of staying away from most of the other locations. So there are some definite limitations here that I would like to mention. First is that I want to acknowledge this very clearly, that we use the change since baseline in movement as a proxy for social distancing. There are a lot of ways to move around and still be protected from the virus. And at the same time, staying at home doesn't automatically protect you from the virus, and there are individual level behaviors that really need to be analyzed. And this is where Allison can also shed some light on how things are done. So the second kind of other question with the mobility data is that it's really hard to interpret it if you just look at the gross mobility data. We spend a lot of time understanding the context of the data. So one example here from our data developer, our software developer, Ben, was we were looking at the data from of people staying home. So lighter color means people staying home. The darker color means more movement. And we were looking at January 11th, and we suddenly saw this white streak cross the United States, the middle of the United States. And it turns out it was a big winter weather storm that was crossing through the middle of the country. So we know that mobility will drop during those kinds of events. There's also right now in the United States events where there are mandatory evacuation orders, like a dam breach in Michigan, and hurricanes both in North Carolina, but also in other parts of the world. My family listening in from India right now is staring down a Category 5 hurricane. And there are evacuation orders in place for a lot of coastal areas in those countries, as well as during natural disasters in the United States. So that kind of data also needs to be taken into account, and that's stuff we're working on next. Another limitation is selection bias from the use of the app. So there are many ways to calculate the mobility, as I mentioned, using mobile devices. And this is something from the New York Times from just a couple of days ago, where they were trying to find where people had left the city during this COVID time. And surprisingly, the richest areas of the city are where people were able to leave the most, not very much in line with what we found. But one methods piece that was interesting is that they used 3 different methods to look at the same question. And one of them, the first one is the Descartes Lab data that we use, and you can see kind of what the inference is in terms of kind of where people are leaving from. So the darker the color, the more people have left. If you look at the middle panel, that's a different type that's looking at cell phone tower signal switching. And you see a bit of a different picture, a little bit less noise, but you come up with the same basic understanding of what is happening there. And then the reason I point this out is that when we analyze the data for North Carolina, there's a lot of contextual information that needs to go into it. there's some report cards and other things that come out that say North Carolina isn't doing a great job social distancing based on the mobility data, but a lot of those average our state, the rural areas with the urban areas. So effectively using rurality as a weight instead of population as a weight. When you reweight the data with population, you actually find that we're not doing that much worse than our neighbors. So I think one of the big lessons and one of the big focuses of the work we do is to understand how to make the data, how to take kind of prima facie data and make it more rigorous and useful for the specific questions that we're trying to answer. And the last limitation that I want to mention, I think, is one that's a evolving ethical issue, which is how do we work with these GPS data? I mean, in our lab, we are only touching anonymized public data sets, but we also want to be aware that using these data is, whether our use of these data is a tacit endorsement of continued more invasive surveillance types, using the same data for less altruistic purposes. In conclusion, what we found was that social distancing has a strong voluntary component. We see this from the privilege metrics as well as from the time-based analysis we saw of North Carolina. And we saw that multiple lines of privilege kind of create a system which influenced the early social distancing. And all of these things combined are very much likely to influence coronavirus incidence as well as mortality. So when we're trying to evaluate things like the effectiveness of social distancing interventions, I think it is imperative to be able to control for these kinds of privilege confounders in those analyses. And I think the movement data are really exhilarating to work with, but they also can be really tricky. What we're trying to do in our lab is to kind of combine all those and the different sources and try to understand how our understanding would change if we used one source versus another. There's one implication that I don't really have an answer for, and I'm curious what others on this call and kind of in conversations later might think. So what does it mean to voluntarily social distance when those with less privilege cannot? And I don't have an answer to this and how my behavior should change or should not change because of it, but I think it's worth thinking about. But there's also a more immediate question that we can answer, and which is, what are the implications of these findings on messaging? And Dr. Allison Lazard will take over and share her really fascinating work on that. And I'm going to give her control.
Wonderful. Sorry, maybe the control doesn't really work.
Okay. Do you want to just project from yours?
I'll just tell you when you advance.
Okay.
Oh, it did?
It did.
Okay, great. There's just a little delay on my part. So thank you, Dr. Nab Dasgupta, for that interesting and insightful. I missed the beginning because my audio wasn't working, so I missed the kind of setup and context. So before I dive into our real-time messaging work, I selfishly just want to take a moment to share how awesome it is to work with Nab. His expertise is deep and his energy is never ending. He often keeps me going, especially these days in what we're doing. So I just want to say thank you to you for all that you do for our team and the work that you've done for beyond our team, the United States, I'd say. So probably this was already set up, but we were asked by our Department of Health and Human Services if we could provide an evidence-based messaging framework to encourage social distancing behaviors. That was like kind of this broad question that we were given, and we said, heck yeah, we can do that. We've got a team. And so that's what we started to do, in addition to everything that you just heard. We know that if we want to effectively communicate, we must first understand our audiences. As Nab has succinctly pointed out, we need to understand what they do. We also need to understand what they think or how they feel, and how that might inform messages that will be well received among those populations, because we really wanted things that were going to resonate and people would use to guide their behavior. And if any of you have listened to the daily briefings, then you have already heard much of what we have found, because we are very fortunate to have this be implemented in real time. And so we've been able to share some of our insights. So along the way, you might hear some phrases that you've already heard often in the briefings with the governor and Secretary Cohen. So to that, beyond what people do, we needed to understand what they think. And that's what we did. We asked them, what do you think? Repeatedly. We've done a lot of iterative surveys. We've done most of these on Amazon Mechanical Turk, which is a crowdsourcing platform with a host of limitations. But the benefit of that is that we could quickly ask North Carolina residents what they think. So within Amazon Mechanical Turk, or MTurk as we often call it, you can select for people by location at the state level. So we could hone in on a North Carolina population quickly. And we did this weekly or bi-weekly, depending on kind of where we were as our team. What you're seeing here is one snapshot of kind of a breakdown. We had about 200 responses each week. They were average age of around mid to late 30s, which is pretty typical of this platform, about 50% female. But as Nab mentioned, and the health department pointed out, there are some key populations that early on that people wanted us to look for and make sure that opinions didn't differ or messages didn't resonate more or less with. And so we have race, particularly Black or African American, political identity, and where people are they in urban, suburban, or rural areas. So you can see this is pretty typical of our breakdown. We weren't great at reaching those populations, but it was at least a first pass at getting their information. Now, can you hear me? Can you nod if you can hear me? Just nod. Okay, because I couldn't hear earlier, so to make sure. And we also did this with a council of, NC Council of Churches, but I'm sharing mostly MTurk data here. So the first thing we did is we tried to understand what they think, what motivates them. We had a team of volunteers, which I'll share many of those names later on, and we called up our friends and family. What motivates you? We read emerging reports. We tried to figure out kind of why are people doing what they're doing? And we came up with a list of, after narrowing down, about 19 motivations. And those broadly fell into 3 different categories. We had other focused messages, like I want to protect other people. We had self-focused messages, like I want to keep myself safe. And then we had this other group, which I'm calling image focused, which were more about like, I don't want people to be mad at me, or I don't want to be blamed for something. And what we found is that other focused and self-focused motivations really resonated with North Carolina residents. That's a 4.5 out of a 5-point scale. You see here, these are the means. But these image-focused messages, not so much. That's not really where people were motivated by. So we quickly dropped that. The next thing that we did in our weekly iteration of this project is we tested some different framing of behaviors. So we knew that we had a strict kind of social distancing, movement reduction, and in-person socialization reduction ask from the Department of Health. And so what we tried to do is test these different, could we change socializing with people outside of your household? Not a good idea to have non-essential workers in your house, only leaving your house for essentials and exercise, and staying 6 feet apart. We initially tested saying those behaviors in a variety of ways, including general versus specific actions, because that was something we heard early on. You need to tell people exactly what to do. Well, as it turns out, that didn't work. People much preferred the general stay at home. And if we asked them, how much does this message make you want to social distance? Our means were significantly higher for those general stay at home messages. And being good social scientists, we also tried some theory and evidence-based approaches. We tried tailoring. We had people type in, we had people report who they were most concerned about, and then we piped that person in that they could protect that loved one. That fell flat. People hated it. We also, looking at Mark Hetherington on our group, his recent national survey, he had found that this resistance to change mindset was associated with fewer social distancing behaviors. And so that might be one thing that we could look at. So we told people that, change is hard, but it's worth it, these types of messages. And again, that didn't work either. I point out these examples because we've tried a lot of things that didn't work before we got to anything that really did work. And before even we get to the things that do work, it's important to acknowledge, like Nab said, the limitations with the mobility data. Another really big limitation is that our target behavior has been constantly shifting. When we first started this, face coverings was not on our initial list of behaviors, but that has quickly changed over the last few weeks. And so as we shift from the shelter at home or stay at home to the safer at home phase, it's really important that we acknowledge that we don't really always know what we should be telling people to do. This isn't quite as straightforward as that we don't really want people to smoke cigarettes or things like that. And so that in our group has been really challenging. But most recently, we have paired enduring social distancing behaviors, and some of those are on the right-hand side, with motivations. So the motivations we selected in this most recent test, we systematically picked 6 that had, across our initial and subsequent testing, rose to the top. And when we looked at those, people rated highest. If you could pair the motivation of keeping loved ones safe or protecting specific vulnerable individuals, your grandmother, your friend with asthma, your neighbor with cancer, people were more likely to endorse that message as something that makes them want to social distance. And beyond that, adding any of these motivations, any of these 6 motivations shown here, significantly increased the desire to social distance. And that was across all behaviors. So that was across staying home to stop the spread, staying home if you're sick. That got introduced as we were having conversations with the retail associations. That would be if you're wearing, for wearing a face covering or staying 6 feet apart. So that's one of our latest key insights, is that we really need to think about pairing motivations with behaviors and looking at things that might work across general recommendations. And so I think that leaves us with time for questions. Before we do, I just want to have one shout out to our amazing team. So there's many of the names listed here. I hope I didn't forget anyone, but it's been amazing to work with everyone. People have been unbelievably selfless with their time as we've been iteratively doing this. So thank you, and I'll turn it back to whoever takes it back.
This is Alexia. Thank you so much, Allison and Nab, for these great presentations. It's really interesting to think about this information. And I want to remind our audience that if you do have questions, please add them to the Q&A box. And we do have a couple. So one that came on early when Nab was talking was, what are composite SES indices?
Sure, sorry, let me put that back. The composite SES, the composite SES indices were from were a metric compiled by Robert Wood Johnson Foundation, and it combined different, I don't remember the exact dimensions, but I think it was like 7 different socioeconomic indicators wrapped up into a ordinal ranking scale. And we looked at that composite score created by RWJ, and then we also looked at kind of those individual components. The income was the most straightforward to interpret, so we went with that one.
Great, thank you. So a question that came at the end. So Allison, I think this is for you. When testing the approaches, were you just using the text, or did it accompany any images or a source?
Mm-hmm. I think this one, if I'm seeing right, is from Trevor. So hi, Trevor. Haven't seen you in a while. Most of the ones I just showed you were text only, because these were going to be part of briefings where they were going to be shared verbally by the health department. But we did a combination of things. We have looked at both kind of packaged messages, existing ones we created, and just text only. I will say these text only messages, the ones that really target those motivations of protecting, those rise above the top across all of them. We use a standard item for this.
Great, thanks. So a question that came in through the chat, Nab mentioned that weather affected mobility. Did the team try to control for that as a confounder? Excuse me.
Thanks, Caitlin, for that question. And thank you also, Caitlin, for answering our questions throughout this process on the data. So we did not control for weather in this particular analysis. Because we were looking at that 3-day period, April 15, 16, 17, we looked at historical weather maps and patterns for the US during that time period. there weren't major dramatic storms and other things happening, so we left that alone. Getting the weather data in is, as you know, like another level of complexity in terms of databases and structures, and so we're working on pulling those in now, and we're really interested in looking at that, especially as an explanatory factor, why parts of the southern, warmer United States are showing more movement change, and whether ambient temperature has a role to play in the motivation for people to move around or not.
Okay. So one question that came in from an anonymous attendee asks, how do we keep this in the news once everything starts to reopen?
I'll start that answer, but I think I want to throw it back to Nab mostly. So we have been looking at this each week, and the behavior has been shifting, but we find that motivation doesn't change. And so I think that is one way that we keep it focused, and we keep the focus, and we keep the advice fresh, is if we think about kind of what's at the heart of what people want. And I'm throw back to Nab because of his voluntary evidence, I think supports that as well.
Well, Allison, you're in the School of Journalism, so I think your answer is the most important one here. But I think we have to acknowledge the voluntary nature of this. I think there's a lot of attention paid to the protests that are happening for Reopen NC and other kind of pushbacks against government mandates. But I think the voluntary concept is going to become pretty obvious as soon as restaurants start opening up again, and other businesses, when business owners start complaining, hey, the orders are lifted, why aren't people flocking to our stores again? And in that scenario, I think there's an opportunity to reinforce the kind of the core voluntary messages and try to understand how things are shifting.
So another question, how did perception of risk, such as how virulent coronavirus is, come into play for messaging?
For us, I'm not sure I fully understand the question, but like we thought about like indoors versus outdoors. That was the one thing that we were focused on. The evidence is accumulating, and I'm speaking out of my expertise right now, which is very uncomfortable, that being outside is safer than being inside. Because it has lower risk of transmission. And so we tried to message on things like that to see if we said specific things, like it would be better to be outside versus inside. We did not find so that is actual risk, I guess, not perception of risk. But we didn't find a whole lot of that really resonated with people. Giving them specific advice didn't work for us, but it could be because we didn't have the right specific advice. So I'm not sure I answered that, but that's where we were. That's where we ended up.
So there's another question from Marissa Halls, who says, great presentations. Question for Allison. Did your research have any influence on the 3 W's that the NCDHHS is promoting? Wear, wash, wait. Curious to hear your thoughts on the potential effectiveness of this type of message.
Well, I think we did. Thanks, Marissa, for that question. The 3 W's came about in conversations, not just with us and the public affairs or external affairs office, but also with retailers, with something that they would feel comfortable with. So we were a part of those conversations. We were not the only one coming up with those messages, but we know that things that are have this, kind of that repetition are easier to remember. So we think that they will. We were very supportive of how they were framing it. Some of the taglines have to do with your friends, or excuse me, I think it's your family and neighbors and protecting them. So we were supporting that. We'll see. We didn't actually test those 3 W's though.
All right, so a question for Nab from Penny. How does he think we might be able to tease apart mobility data for stopping social distancing versus healthcare workforce going to work?
That's a great question. And so we analyzed these at the county level, and I think there are more granular cell phone mobility data that are available. So one example is that we have applied for funding to try to get access to is to look at foot traffic and look at census blocks, and combining that with venue-specific information would give us information like specifically on traffic around hospitals and other healthcare facilities. So that would be like the most observational way to look at it, I think. Those kinds of data are used now for foot traffic, like in malls and and other retail locations, to understand the the pattern of people stopping in front of different stores. So there's a lot of granularity to that information, and it seems a little creepy to have that kind of very detailed information. That particular data set is an opt-in data set where people are in a panel and are aware of the geo-tracking that's happening in those circumstances. So, and they're getting paid for that, or compensated with gift certificates and things like that for that purpose. So that'd be one way to look at it. And if you guys have other suggestions, we're always open to listening to those as well.
Great. So a question for Allison, also from Penny. How do you think we should deal with the political issues around mask wearing, and how has it become such a controversial issue?
Well, to be candid, we were, as a group, were hesitant. I was hesitant to address face coverings until that we got that clear signal that that was something that the health department wanted, because of the potential stigma and blame and differences among various populations and their comfort with wearing face coverings. I think this is something that we cannot forget, that not all people feel equally comfortable wearing a face covering in the United States. And I think it's become a political issue for that reason, as well as the requirement, the being asked. I think we have to be really careful as we go forward at the University of North Carolina and our state and broadly US, how we message on the must-haves for doing such an action when we know that not everyone comes to that situation equally.
Thank you. The next question is from Emily Gower. How much of an impact do businesses impact the reduced movement? Many businesses voluntarily close before the stay-at-home orders. Trying to ask whether businesses reopening will impact movement. If people voluntarily want to stay home, but their offices reopen, they have no choice but to increase movement.
Yep, that's a great observation, and very much in line with what we are expecting to happen. So I think when we saw the reduction in mobility in mid-March, it happened coincident with there was businesses closing, schools closing, universities sending people home. There was a lot of things happening at the same time. Now that businesses are opening up in a staggered way across different states, we have an opportunity to understand that. There's one of the data sets that we have been pulling in, but we haven't started analyzing, is it gives us retail credit card spend by day across the United States. So we will be able to kind of specifically look at kind of how much money is being spent as a proxy, again, for how much businesses are being visited. And so the idea would be to triangulate across those sources, but it's definitely definitely something we're keeping on top of our minds. It's interesting that the phase 2 for North Carolina is set to go into effect Friday at 5 p.m., which is the day that has the most traffic, right around the time that has the most traffic historically. So I think the timing of that, I don't know how intentional it was, but kind of is primed to be kind of a bigger opening than pretty much any other time of the week.
Noel Brewer asks, can NAB say more about the validity of the social distancing measure? Say more about when these data will overlap well with social distancing and when it will show mostly something else.
Thanks, Noel. I think there's a lot to unpack on that, and I'm happy to go into more detail one-on-one, but the general sense is that, so if you look at some of these dashboards and public data sets, there's over like 50 different social distancing metrics that get calculated, and finding the right ones that have the right construct validity, but also kind of the face validity is really tough. And so and what I've been finding is that the gross overall mobility measures seem actually the least buffeted by small changes in definitions and idiosyncrasies across the different data sets. So I think if we're looking at large area analyses, like across the United States, the gross mobility measure, I think, is useful for creating that kind of broader picture. For the smaller area analyses, I think, choosing selectively from across different data sources is the best way to, I think, so far, to triangulate and validate what we have. I mean, it'd be ideal to conduct our own our own distance tracking studies. But I think right now, based on what we have available to us, going across data sets is our best hope, given that there's different selection processes for those data sets, measurement processes, all that needs to be taken into account. But selectively using the metrics across them to compare against each other is what we've been doing.
All right, so we have time, I think, for a quick last question, which was, can the data be used for contact tracing?
Our data cannot be. Data collected through similar means can be, possibly, but we don't get any personally identifying information, so we would not be able to do that.
Well, thank you both so much. This was a great presentation, and I've seen several comments about people who are really impressed with the data and also the great visuals that you have in your presentation. So thank you again so much for participating in this, and I'd like to remind everyone that we will have another one of these webinars coming up on Friday, May 29th, and more information about that will be coming out soon. So thank you all.
Thank you.
Bye.
Thanks.